pharmacist at the VA Loma here at the Abajo conference, presenting a case study or case report of 14 patients on abiraterone in fed versus fasted states. Abiraterone has been FDA approved to be given on an empty stomach at 1,000 milligrams a day dosing. And I had physicians who were interested in giving abiraterone with food, and the reasoning behind that was there's actually pharmacokinetic studies that has during the phase 1 trials have proven or have shown that abiraterone has a much higher absorption when given with meals. So as a pharmacist, every time there's a deviation from package insert, you feel uncomfortable and you want to know. So since this was a deviation from package insert, I wanted to know where we stand and how those patients are doing. So at the end of 1 year, I ran a report of all the prescriptions that were filled for abiraterone and was able to choose 14 patients. And luckily, since this is a retrospective case report, 7 of those patients had taken this medication with food and 7 had taken it without food. Draw of luck. I had nothing to do with it. And when I looked at the side effects, as you can see, and another thing that's very important is that the patients that had taken it with food had taken it at half the dose. About 500 milligrams was the average dose, and patients that had taken it on an empty stomach had taken the FDA-approved dosing of 1,000 milligrams. So that's a major difference. So 50% dose difference between the two groups. But when we looked at the adverse events, they were very compatible, as you can see. Hyperkalemia 2, 3. Although these numbers are very small, I can't really report any serious results. It's merely an observation, and it was mostly because I wanted to feel better about the patient population, and I wanted to make sure that I'm not harming anyone. And as you can see, the adverse events between the two groups seemed very similar. And when I looked at the PSAs of the patients, interestingly, 7 and 7, fasted and fed, it seems to me like the patients that are taking it at a lower dose of 500 milligrams with food are having more consistent PSA reported than patients that are taking it as FDA approved up here in the fasted state. And some clinical characteristics that I wanted to show is that our average age was 71 years old. The Gleason scores were 7 or higher, so these are sicker patients. And 3 out of 6 patients were using it as frontline treatment. In other words, they hadn't failed chemotherapy yet in the fed group, and 4 out of 8 in the fed were using it as second-line treatment. Other than that, like I said, it's not a study, it's a case report, and I cannot report any results. But the conclusion was that it is safe taking it with food versus without. The results are compatible. So as a pharmacist, I feel much better now that I see these patients on these doses. And also, if and when someone decides to do a full-on study with this medication, there is a potential cost saving of 50%.